There are three main issues that bring physicians to see me. The first one is that they feel they're on the verge of burnout, or they've moved into burnout, and they just feel less joy and enthusiasm and satisfaction in their work and life. And so they're looking to find ways that they can get themselves out of that situation. The second thing that they come to see me with is they're really finding that they're very dissatisfied, frustrated, not feeling fulfilled in their careers. And they're not even sure they want to stay in medicine anymore, but they don't know what else to do. So they come from me to look for, for help in other careers, whether it's clinical, non-clinical, or even non-medical careers. The third area that brings physicians to me is physicians who want to acquire a new set of skills and knowledge that they feel will help them better manage their careers and function better in their organizations. All right, well, actually my initial response was, why shouldn't they? They absolutely need to. So, but the reasoning is physicians lead very, very demanding lives. And this starts in medical school and goes on through their training. They have to meet challenges on a daily basis, make decisions, and move forward. And this is admirable, and it's often very necessary. But when it's taken to an extreme, it can lead to a kind of mindset of going it alone. And this can definitely lead to a situation where to ask for help or look for support is seen as a weakness both by themselves and by their colleagues. The problem with this is it leads to a terrible collusion of silence, which then creates further isolation and a sense of failure. The consequences of this can certainly be that people adopt unhealthy or maladaptive behaviors, which only worsen the problem. I incorporate it all the time as best I can. And the things that have always sustained me, I've always enjoyed physical activity, whether it was through sports or just exercise. And I've always found that if I maintain some kind of physical activity on as regular basis as I can, that it maintains my own vitality and my own energy. I began journaling many years ago, and I've used it as a resource to put down my thoughts, to gain clarity of thought, and also to vent at times when things are getting too much, but it's a safe way to vent. The other way I've used a journal is to periodically check in with what I feel are my most important priorities and my goals, and what are my real purpose in my life, and what is the impact I want to have. And I find that this is, by regularly doing this, it helps me feel grounded when the world might feel like it's spinning out of control. Above all, my advice would be not to see self-care as a luxury, as a selfish self-indulgence. I would recommend that physicians make this a necessity in their life, and they bring to it the same commitment that they bring to other things. The problem with putting it on the optional list is somehow there's never enough energy, time, and motivation to incorporate it into a very busy life. My belief is that however challenging, self-care is seen as a non-negotiable, essential, and vital ingredient for achieving a thriving, sustainable, and fulfilling life and career. I think one of the biggest challenges that face physicians is a sense of a loss of autonomy and the ability of being in charge of making the best decisions for their patients. This can make them feel like they're losing control of their own profession. And there's an old adage that I would remind people of, that if they start to feel like bringing well-being into their life is just something they can't manage at this time. And the adage is, if you don't make time for health at this point, make time for sickness later.